Thank you, folks, and welcome. Medicare made easy. Does anybody even think that's possible? Well, we'll see after today. Hopefully you'll get a better idea of how the different puzzle pieces fit together. So, once again, my name is Howard Peck. I own a small agency in Green Lane, Pennsylvania, a little west of Harleysville. We're called Senior Insurance Solutions, and all we do is specialize in helping people with Medicare. We help people purchase Medicare supplement plans, also known as Medigap, Medicare Advantage plans, and Part D drug plans. I'm not associated with Medicare. I'm not associated with the federal government, nor CMS, which is the bureaucracy that manages Medicare and Medicaid. So just as a disclaimer, I'm an independent insurance broker that specializes in Medicare planning. So this morning, we're going to offer you a brief history of Medicare that hopefully you'll find interesting, show you Medicare Parts A and B and how they fit together, show you the different supplemental options and your drug plan options, talk about the different enrollment guidelines, show you how Obamacare or the Affordable Care Act intersects with Medicare, show you 3 smart Medicare strategies, and offer you the 2 top secrets to making Medicare easy. So, the format today is a bird's eye view. There's not going to be a lot of mind-numbing details and charts and facts and figures. You'll see that we're just going to take a bird's eye view to show you how everything fits together. No insurance company endorsement. I represent several insurance companies. Nobody is sponsoring this. It's an educational seminar, as Nancy mentioned. Nobody's going to be hounding you after this. If you did sign up, and I recommend that you do sign in, you'll get put on our mailing list to receive our quarterly newsletters. Our latest issue is in the packet that you received today. And if you want to receive more of them, just sign up and you'll get them in the mail. And questions are welcome anytime, so feel comfortable and feel free. Okay? Everybody hear me okay back there? Okay, good. So, the beginning of Medicare. Anybody recognize that guy? President Truman. And President Truman, his administration was the first administration to begin the discussion about national health insurance. Our country was changing, demographics were changing, they saw something was needed, and this is where the discussions pretty much began. Didn't really go anywhere, but they began. The next administration, President Eisenhower, his administration started talking about subsidizing insurance companies so they can keep their rates low so everybody can have easy access to insurance. Discussions continued, didn't really go anywhere. But next came President Kennedy, and he actually ran for president with health insurance as a major issue in his campaign. So, believe it or not, Congress wasn't thrilled with this discussion about national health insurance. The American Medical Association wasn't thrilled with it, so they hired a paid spokesman to get their message across. And that was Ronald Reagan in 1961, when he was an actor. And that was the cover of a 33 RPM album. And it says, if you can't see it, Ronald Reagan speaks out against socialized medicine. So there was a lot of concerns. There'd be less freedom for doctors and patients. Quality of care could be threatened because of that. And it was the first step towards socialism. Because back then, there was a fear of socialism. And what did we used to call that area? That era. Remember what it was called between us and the Russians? Cold War. Yep. And there was a Cold War going on, if you remember. Khrushchev, if you remember that guy, and Castro. So there was a concern of anything that even smelled like socialism. But nevertheless, we had that unfortunate day in Dallas when President Kennedy was assassinated and President Johnson was sworn in. Anybody know where that swearing in took place?
On planes.
Yep, on Air Force One. They pulled Jackie away from the hospital so they can send a photo around the world that there was a peaceful transition of power. So President Johnson then had a rerun for president after he was appointed from President Kennedy being assassinated. He ran against Goldwater. This is some interesting presidential trivia. He beat Goldwater by a margin of 61-39, which is unheard of in modern politics, right? And it's the largest margin ever in presidential elections, 61-39. Now, as you know, presidential elections are by razor-thin margins. Nevertheless, a little presidential trivia while we're at it, vice presidential trivia. Who was Johnson's vice president? Anybody remember? Hubert Humphrey. Now, a lot of people don't remember that, but for some reason, they remember where he was from. Is anybody remember? Right? Minnesota, for some reason we know that. And what did he do before the vice presidency? Senator, and the mayor of Minneapolis. So in today's political commercials, they would call him a career politician. And then after the vice presidency, anybody remember? He ran against Richard Nixon and lost. So that was Hubert Humphrey. So President Johnson, he was a busy guy. In just 4 years, he created the Great Society Initiative, and major legislation was passed in 4 years. If anybody has noticed, nowadays Congress can't even talk to each other, let alone pass major legislation. And in 4 years, look at these major acts that were passed. Amazing. And Medicaid was passed, which is health insurance for impoverished citizens, and then Medicare finally in 1965. It was part of the Great Society Initiative. And when it became law, the bill signing was at the Harry S. Truman Library, and the recipient of the first card was President Truman, because it was in his administration that the discussions began. And that's the bill signing ceremony. There's President Truman. Who's over his shoulder? Anybody remember her name? Yes. Bess Truman. Of course, the lady in the middle, Lady Bird. And he signed the bill and gave Harry Truman the first Medicare card. So in 1965, when the bill was passed, it was a different world. Gas was 32 cents a gallon, as you can see, nickel a mail a letter. And warnings were placed on cigarettes back then for the first time in a little pop culture, 1965. So they passed the law, and now they had to implement the law, and this is what took place. They had to reach 19 million people that were eligible for this new plan. Today, there's 55 million people on Medicare. Amazing bureaucracy. They had to sign up 7,000 hospitals that were going to start accepting this plan, contracted with 48 private insurance companies to help them administer it. They met with 2,000 doctor groups. They opened up 100 offices around the country, hired 9,000 people, and we can't imagine it, but they actually did it without the internet. No emails, no conference calls, webinars. They had to pick up the phone and dial each digit one at a time to talk to somebody. But nevertheless, they did. So, Medicare, who's eligible? Folks that are 65 and older, or if you're under 65 and officially disabled, or have end-stage renal disease, which is being on kidney dialysis, or neurological disorders such as ALS, which is known as Lou Gehrig's disease. That's who's eligible for our national health insurance plan. There's two parts to the plan. Part A takes care of hospitals, facilities, and home care. It covers everything except doctor costs, which are the most expensive part, typically. Part B covers all your medical services, including doctor costs, outpatient and inpatient, lab and blood testing, all kinds of diagnostics. Now, the good thing about this is that once you go on Medicare, you never have to worry about this or think about it. How all that's divided up and how it's billed, that all happens behind the scenes. You just show your provider your Medicare card. But this is how it's divided up. So what does it cost? Part A doesn't cost anything. Part B in 2019 cost $135.50 a month. If you're collecting Social Security, it automatically gets taken out of your Social Security check. If you're not collecting Social Security, they will bill you quarterly. The $135.50 is the base amount. It's for people, individuals that make less than $85,000 a year, or couples that make less than $170,000. If you make more than that, the $135.50 will go up incrementally. So, what's not covered by Medicare? You enroll in Medicare, you have your red, white, and blue card. What's not covered? Well, routine dental care and dentures are not covered. Routine vision care is not covered, meaning exams for eyewear and eyewear. All medical conditions of the eye are covered. So if there's glaucoma, cataracts, macular degeneration, that's all covered by Medicare. Elective or cosmetic surgery, not covered by Medicare. Alternative medicine, like acupuncture as an example, not covered by Medicare. Hearing aids and fitting exams for hearing aids should be covered, but they're not covered. Care received outside of the U.S., once you cross the border, Medicare's out of the picture. Non-emergency transportation is not covered, but ambulances are covered. And lastly, non-medical custodial convalescent care. The services that send folks into your home to help with bathing, dressing, walking, getting in and out of bed, etc. Non-medical care. So that's what's not covered by Medicare. So, Medicare, you need to enroll. If you're collecting Social Security, however, you don't need to enroll. Enrollment in Parts A and B is automatic when you turn 65 if you're collecting Social Security before age 65. There's nothing you have to do. If you're not collecting Social Security, you have to voluntarily enroll in Medicare. And you can do it 3 months before your birthday month. So if you turn 65 in 1 month, you can go backwards, and 3 months prior, you can enroll in Medicare. The next slide illustrates that. If you're older than 65 and you're still working and you're covered by your employer's insurance or your spouse's insurance, there's no need to sign up for Medicare. When you stop working and you lose your health insurance for that reason, you then enroll in Medicare. There's no penalties, no problems. Yes, you both raised your hand.
I enrolled at 65, I'm 66 now, I'm still working, but that doesn't really matter at that, even though I'm enrolled.
Pretty much. You enrolled in A and B?
No, just A.
Just A. So a lot of people call up Social Security or go there, go like, enroll in just Part A. You're in the system, no big deal, it doesn't cost anything,
Right.
but your employer insurance will supersede your,
Right.
the Part A. Yeah, not a big deal. The most important thing is that Part B. That really covers your
Like,
medical.
I'm thinking, my wife and I both work for the same employer. I'm thinking about retiring in about 4 months, and I'll be going on her insurance. At what point, I guess, I look at Part B, and he covers that after she retires too?
Correct. Yep, you're covered by her,
Right.
and when she retires, you both go on Medicare.
Okay, so there's no, I mean, I don't tell my doctor I'm on Medicare or anything like that until we both retire then?
Correct. Yeah, we'll address that a little bit.
Okay.
Yeah. You have a question?
Yeah, can I just clarify? You're eligible at literally your 65th birthday. It's not like Social Security where it's graduated based on how old you are. There's no phasing.
Correct, unless you're on disability.
Right.
Yes.
But 65th birthday for everybody.
You're actually, Medicare's going to start the first of your birthday month.
First, okay.
Yeah.
Okay, thank you.
Yes.
But you have to enroll even if you have private insurance, so you don't get a penalty?
No, it's not true. It's one of those myths.
Or
You
get-
can enroll in Part A, but I do not enroll in Part B if you have employer insurance, because your employer insurance it works, right? Why should you pay $135 a month for Medicare?
Even if you're 65?
Yeah. Oh, yeah, I have clients that are rolling in their 70s for the first time because they or their spouse just retired. Not a problem.
Yeah. But enroll in Part A,
If you want to, you can, but you don't have to.
so you don't get a penalty?
No penalty, I promise. Yep. As long as you're covered. If for some reason you turn 65 and you retire and you say, you know, I've had health insurance my whole life, I'm taking a break, this stuff's expensive, I'll go on Medicare in a few years. And in 68, 69, you knock on the door, you say, I'm ready to enroll in Medicare. Then you get a penalty because you didn't have insurance from the time you were 65 until the time you enrolled in Medicare. But if you had coverage, doesn't matter what age you enroll. And I'll address that in the next
So
slide.
if you're gonna retire, let's say you turn 65.
Yeah.
Let's say in May.
Yep,
But you're not gonna retire until next year.
yeah,
And so you're gonna stay in your employer health plan until next year.
Yeah.
Next year, you
Yep.
enroll?
yep, 66, 67.
Right before your birthday, or?
I'll address that
Okay.
too. Yep. You have a question, sir?
I think you're gonna cover it, but I think what she's getting at,
Yeah.
I could be wrong, is, so let's say that, I retire after I'm 65, and, so what's the process to enroll so that when I retire, I don't lose any gap in
Yep.
coverage?
And I'm going to address
That's what I
that.
figured.
Yeah. And just for reference, at your own time, at your own leisure, there's a flyer in your handout packet that's just about enrollment. It just shows you the 5 scenarios of enrolling in Medicare. Okay, so, but nevertheless, we're going to address pretty much
Thank you.
that. That's it. Yep.
Good.
So, let's say you're not collecting Social Security and now you have to voluntarily enroll, and your birthday is in May. You noted that by coincidence.
He knew.
You can enroll 3 months before your birthday month, February, March, or April, and it will be effective May 1st. So the bottom line is you have 90 days to start the process. So once you get your retirement date in focus, 90 days out from your Medicare, then you start the enrollment process. So if you walked into Social Security or called them and said, I need Medicare to start May 1st, and let's say it's February, just tell them you need it to start May 1st, and you'll get your card that says May 1st on it.
And is that for Part A, B?
Well, if you're leaving your employer plan, you're gonna need full coverage, so it's A and B.
But if not, just.
If you want to enroll in A, you can, not necessary. So enrollment over age 65, I think a couple of you asked. You're coming off an employer plan or your spouse's plan, and just kind of reiterate a little of our conversation. Any time of year, there's no calendar restrictions. It's not like you can only enroll this time of year. It's whenever you're coming off your employer's plan, that's when you start the process. And here's the important point, you can enroll 3 months prior to your target date. And no matter how old you are when you enroll in Medicare or what your health conditions may be, there's no pre-existing condition issues. Everybody's accepted no matter what. So, there are late enrollment penalties that I just mentioned. So if you turn 65 and you don't have insurance for a year or 2 years and then you enroll in Medicare, they will penalize you. And the penalties last the rest of your life. That goes for the drug plans as well. So if you're thinking about delaying anything, call someone like myself and we can give you the guidelines and the possible penalties. So a quick review, because it's important. If you're turning 65 and you're collecting Social Security, there's nothing you have to do. You'll get your Medicare Parts A and B. If you're not collecting Social Security, you have to voluntarily enroll, and you can do it up to 3 months before your birthday month. You can call, you can go online, or you can visit a local Social Security office. The easiest, less time-consuming is going online to enroll. If you're over 65, there's no calendar restrictions whenever you're ready to retire. Once again, 90 days before, and then again, no pre-existing condition issues, no matter how old you are. Now, when you enroll in Medicare, there are gaps in coverage. Part A, there's coverage gaps. Part B, there's coverage gaps. Here they are. When you go into the hospital, there's a Part A admissions deductible of $1,364. So the Part A portion of your Medicare will start paying after that $1,364 is paid by you. Next, Medicare gives you 20 days of free skilled nursing rehab. After that, if you need more, they'll give you 80 days for $170.50 per day. So that's if you're in the hospital, you had surgery, you can't come home yet, you need a few days, a few weeks, or something to get on your feet. Medicare gives you 20 days at no cost, but then after that, it's $170.50 a day. Yes?
Is that 20 days per event, or is that 20 days per annual or life?
Per episode, per event,
episode?
yes.
Okay. Thank you.
Then on your Part B medical service, there's a $185 a year deductible. So let's say we're coming up to March. If you start Medicare in March, from March 1st to December 31st, 2019, you're responsible for the first $185. Not too bad, but the next one's the big one. You're also responsible for 20% of all your medical costs. Medicare picks up 80%, you're responsible for 20%. So those are the coverage gaps. So consider, and they change, everything changes except the 20%, that's a constant. The others change by just a few bucks. For instance, that yearly deductible of $185, in 2018 it was $183. So considering the coverage gaps, there's 3 ways to use Medicare. And it coincides with the fact that back in the early 60s, there were 3 people that sat around the table that came up with this system. Because sometimes I'm asked, what a crazy system, A and a B and a coverage gaps and supplements. Who came up with this? Well, these are the 3 founders of Medicare back in the 60s. That's what it seems like sometimes, right? But there really are 3 ways to use Medicare. The first is just to use your Medicare card, but you're subject to the back gaps in coverage. There's no rules or regulations that you must have a supplement. But I don't meet many people that just want to go that way, because that 20% could be devastating. So you can also choose what's called a Medicare Advantage plan, which is typically an HMO plan. In this area, the most popular ones are HMOs. It's a coordinated care plan, or also known as managed care plan. Then the next option is what's called Medicare supplements, also known as Medigap. Medicare supplements and Medigap are synonymous. And these are policies that specifically cover the coverage gaps in parts A and B. So I'm going to go over number 2 and 3 just in a very brief, basic way so you'll understand the differences. If you choose a Medicare Advantage plan, it's an official part of Medicare. So your Medicare card is A and B. Well, these plans are Part C. They're sold by private companies, but they're heavily regulated by Medicare, all for the benefit of the consumer, all for the benefit of the Medicare beneficiary. So that's why it's called Part C, because they're very integrated. With these plans, remember those gaps that I just showed you? Well, with these plans, all those gaps are paid behind the scenes. They're all paid by your insurance companies behind the scenes. And then you just go on their plan, which is an all-inclusive coordinated plans. So they pay all those gaps in exchange for premiums that you pay each month and co-pays when you go to the doctor. Now with these plans, you don't even need your Medicare card. You just use your Medicare Advantage card because it's so integrated. You just show the one card. With these plans, there's doctor networks and hospital networks. You have to go to certain doctors and certain hospitals. Some of the plans, though, have enormous networks. There's co-pays every step of the way to see doctors, specialists, surgery, emergency room. There's co-pays every step of the way. But with these plans, there's some extras. There's some minimal dental, preventative dental and vision, a little bit of hearing aid allowance, and silver sneakers. Anybody ever hear of silver sneakers? So silver sneakers is a program that these plans offer where it pays your membership at places like this to work out at the gym, YMCAs, different facilities like that. So that's Medicare Advantage. It's almost identical to the type of coverage we had when we were working. Typically there's doctor networks, there's co-pays, etc. Yes?
I'm sorry, before you move on, you told me about the 20% copay under Part B. This has smaller copays, but
Smaller
they're
copay, so
typically
that
smaller?
20% is taken care of behind the scenes,
Right.
but you will have copays when you see the doctors in the hospitals, much less than 20%.
Okay.
Yeah. Okay, so there's our 3 ways. Just went over a little bit about Medicare Advantage, coordinated care. Biggest one in this area, by the way, is Independence Blue Cross Keystone 65. It's the biggest one. Every doctor and every hospital's in their network. It's a good plan. Now we're going to talk about Medicare supplements, also known as Medigap. So these are different. So these are specific private plans, meaning sold by private insurance companies, that specifically fill those gaps in coverage. If you remember, there they are. That's the 20% that you just mentioned, sir. So with these policies, those gaps don't get paid behind the scenes. Your supplemental plan pays for these coverage gaps. So the government standardizes the plans. They're slightly different. And the government, in its infinite wisdom, thought that we need 10 plans to choose from, which really makes it difficult. I don't know if anybody has seen these charts, if you've done any investigation, but there's 10 plans. The good news is, over the years, 3 plans have risen to the top, and these are the 3 that most people are buying. These are the ones that I sell, Plan N, G, and F. So the investigation to what Medicare supplement plans to buy is easier than it looks, because there's only 3 plans right now that people are buying. Now with these plans, from company to company, the plans can't change, but the prices can. So the government standardizes them, so if you choose a Plan G, Aetna might charge less than Cigna. Cigna might charge less than Mutual of Omaha. Mutual of Omaha might charge less than Blue Cross. It could be a spread of $10, $20, $30, $40 a month for the same plan. So it's good to shop around and work with someone that can show you quotes from different companies. The plans can't change from company to company, but the price can. So with these plans, there's that large hospital deductible, these plans pay that, you never have to worry about that. 100% covered, and there's that 20%, sir, that you brought up, your supplement pays that. Skilled nursing, those 80 days that are 170.50, that's covered. And there's that Part B deductible, some of the plans pay it and some don't. With these plans, there's absolutely no networks. Think of it this way. Your red, white, and blue card, your Medicare cards, are your national health insurance plan. It's accepted in Doylestown, Dallas, Texas, or Cincinnati, Ohio. It doesn't matter where you are with that red, white, and blue card. And these supplement plans follow that card wherever you are. So you have absolutely terrific coverage. There's no referrals to see specialists. You just pick up the phone. The way it works, the relationship is that Medicare is your primary, these plans are your secondary, and if Medicare pays their portion, these plans must pay their portion. They don't have a choice. They're not in the decision-making loop. They just wait for notification. Medicare paid 80%, they send a check for 20%. Very simple. It's guaranteed renewable as long as you pay the premiums, the plan stays yours forever. And the costs are predictable because there's minimal or no co-pays. You know your monthly premium is the cost of your health care. And the benefits don't change. If you choose a Plan G today, it's going to be Plan G forever. So, with Medicare supplements, you actually have to show the doctor your Medicare card because that's going to cover 80%. And then you show them your Medigap card to cover the 20%, and you're just about 100% covered with some small exceptions that I'll show you in a moment. So, a quick apples to apples. Medicare Advantage on the left, that's your HMO style of Medicare supplements. So with doctor visits, there's typically co-pays, but with Medicare supplements, none. With hospital stays, there's co-pays, with Medicare supplements, none, which means you walk out of the hospital, folks, with the supplements without a bill. Literally without a bill, no matter how long you were in or what you were in for. Same-day surgery, again, co-pays, but none. Emergency room, same thing. And the administration of the plan. No referrals are needed with Medicare HMOs, but there are networks. But no referrals and no networks with the supplements. Out-of-pocket costs, of course, over here, yes, because it's based on a copay system. And with one exception, really, there are no copays typically with Medicare supplements. Now, Medicare Advantage costs less than the Medicare supplements, and the Medicare supplements cost more than the Medicare Advantage. So the concept is, if you try to figure it out, Medicare Advantage folks say, we're going to charge you a low premium every month, but when you use it, there's co-pays every step of the way. The Medicare supplements folks say, we're going to charge you a higher premium each month, but when you use it, just about no out-of-pocket costs. And those are your two choices when you go on Medicare.
That slide would make a great handout, by the way.
Yes, absolutely.
Is it on your website?
It's not on my website, but my business card is there in the packet. If you want to shoot me an email, I'd be glad to send it.
Thank you.
Okay, so the one exception that I mentioned a couple of times is Medicare Supplement Plan N. Very popular. There are co-pays with Plan N. It's the only supplement plan that has co-pays. $20 for primary doctor visits or specialists. No matter how expensive that specialist may be, it's $20. ER is $50, and they waive that if it's admitted. What's not covered is that $185 yearly deductible. You have to pick up that once a year. But other than these relatively small out-of-pocket costs, everything else is covered 100% with Plan N. There's no referrals, no networks, and Plan N is usually 25% less than the other supplements. So if you want to keep your monthly premiums down and you're willing to pick up a little bit of out-of-pocket costs, folks choose Plan N. It's a good plan.
So it protects you against a catastrophe. If
Oh,
you're in
yeah.
the hospital,
Yeah,
it covers you, but if you got a sniffle, you pay your copay.
there you go.
Okay.
You're saving on monthly premium.
Okay.
Yeah. Okay, quick word about pre-existing conditions. When you enroll in your red, white, and blue government Medicare, there's no pre-existing condition issues. Everybody's accepted. If you choose a Medicare Advantage HMO, non-issue. Everybody's accepted, no questions asked. However, the Medicare supplements work a little differently. When you buy a Medicare supplement 6 months from enrolling in Medicare, there are no questions asked on the application. Everybody's accepted. However, after that 6-month window, then there's medical questions asked. So let's take a quick scenario. You buy a Medicare supplement, Plan N from Mutual of Omaha, and maybe their rates keep going up every year. You get a rate increase every year. You give me a call a few years later, you say, Howard, you know that supplement you sold me from Mutual of Omaha? I think I want to look at another company. They keep raising their rates. So then we look at some companies, we see if we can save you some money, but you have to answer medical questions on the application at that point. First time around, there were no medical questions. This time there will be, and they can reject your application. You'll never get kicked off the plan that you're on, but a new company can choose not to give you a supplement if you can't answer the medical questions. There's no blood test, there's no urine test, there's no doctor visits, just questions on the application. Okay? Let's take a break from all that serious stuff for a moment and talk about baby boomers turning 65. From 2011 to 2031, everybody that we know and love is turning 65. And about 10 to 11,000 people a day are turning 65. So our country's changing rapidly. So here's some of the rich and famous that are turning 65. Never thought they'd turn 65, right? John Travolta, Saturday Night Fever. Oprah and Howard. I think between both of them, you have the GDP of most countries in the world. Their net worth. All turning 65 this year. Okay, this guy turned 65 2 years ago. You all know him. Does anybody recognize him? Jay North. And then in 2016, this guy turned 65. And that's Jerry on the left, June and Wally. There they are. So, let's talk about Part D prescription plans. When you enroll in Medicare, your red, white, and blue card, Parts A and B, does not cover meds. If you choose a Medicare Advantage HMO plan, the meds are covered in the plan. You still pay co-pays at the doctor, at the pharmacy, but you do not pay a premium to be on a Part D drug plan. However, if you choose a Medicare supplement plan, meds are not included and you need a separate Part D drug plan. So you really only need a separate Part D drug plan if you are on a Medicare supplement. With the Part D drug plans, there's a monthly premium. The lowest in the country right now is about $14 a month, and it can go up from there. There's deductibles usually for brand name drugs. The deductible's in the neighborhood of about $400, so you have to pay the first $400 for brand drugs before the co-pays start.
Per year?
Per year, per calendar year. These plans can change yearly, and you can change them yearly. So every year during the annual enrollment period, you can change your drug plan. There's a lot of low-income assistance programs available, state-sponsored, terrific programs that keep the meds real low if you can qualify. So with these plans, this is just an example. It's just not real life, but the monthly premium of $19, there's your brand drug deductible of $405, and then there's co-pays based on the different tiers. This is just an example. So with these plans, you have to be careful. Does anybody know what that means in Latin?
Buyer beware.
Buyer beware. And with these plans, you really have to beware. There's 30 plans in Pennsylvania, 30 Part D drug plans, all selling the same meds. So how do you choose which one's the best one? The monthly premiums vary, the deductibles vary, co-pays for the same brand or generics vary from company to company, and the tiers can vary. You have the generic drug, one company puts it on tier 1, the next company puts it on tier 2. So how do you figure out what to do? It's a crazy system. not user-friendly, national disgrace, but there's a solution built right into it that not many people know, and that's Medicare.gov. And this is what I do for my clients. I run your meds right through Medicare.gov. And Medicare.gov gives me back a little analysis of all 30 plans in Pennsylvania, and it ranks them from least expensive to most expensive. So it's the most efficient way to choose a drug plan. And if you do this, I say that it allows your plans to be prescription driven. So I go into a lot of homes that people ask me to come in and do some comparison shopping. They've been on Medicare for a few years. They show me their drug plan, and I clearly see it's not the best plan for them. So I always ask the question, even though I know the answer, just to be a little dramatic, I go, why'd you choose that one? And they'll say, oh, my brother-in-law has, and he said it was great. When I saw it on television, I called up, they signed me up, and they're paying way too much. So this method, which is available to the public, but I do it almost every day for clients, is the only way to choose a Part D drug plan. Also for low-income residents, a program called PACE, PACE-NET, again, keeps the meds real low if you can qualify. It's a great plan if you know anybody. If you want the qualifying numbers, you can call me and I'll give them to you, but it's a terrific plan. Okay, the annual election period. So during this period of October 15th to December 7th, commercials on television all the time, you get mail all the time. It's only for folks that have a Medicare Advantage HMO plan or a Part D drug plan. If you want to change these plans, this is the time of year you have to do it. If you have a Medicare supplement plan that we discussed, you can change those plans, believe it or not, any time of year. But this is the time when you change these type of plans. If you're happy with your Medicare Advantage plan or you're happy with your drug plan, you don't have to change. But if you want to change, this is when you do it. A quick word about Obamacare and Medicare, also known as the Patient Protection and Affordable Care Act. Real quick, it's for folks that are under 65. Once you transition to Medicare, you leave the Patient Protection and Affordable Care Act behind. So they don't intermingle, they don't mesh, they don't work together. They're both government-sponsored plans. And once you turn 65 and go on Medicare, you leave the ACA behind. Quick word about Medicare and long-term care. So let's define long-term care. Today we're talking about medical care. Treatment, prevention of sickness, disease, that's what Medicare covers. But there's also something called long-term care. That's when you need someone to come into your home, or it's in a facility, and you need help with what they call the activities of daily living, all non-medical help. So this is what long-term care costs in Pennsylvania, southeastern Pennsylvania, average. It's very expensive. So how do you pay for it if you need that type of care? Well, Medicaid will pay, but you have to be impoverished and you have to qualify. Retirement savings can pay. Private long-term or short-term care insurance, and if anybody's interested in looking at that, I can give you some references. If you do have a long-term care or short-term care policy, it pays for room and board at assisted living facilities or nursing homes, pays for home care, but if you have these policies, Medicare still pays for your medical care. Okay, so it's something you might want to look into. Okay, a quick review from today's festivities. There's coverage gaps with Medicare. It doesn't cover everything, especially that 20%, and that's why we need supplemental coverage. So we either choose a Medicare Advantage. This is replaces those gaps behind the scenes. Now you're on the coordinated care of the insurance company. There's networks, co-pays, and of course there's the drug plan option that's included in the plan, though you still pay co-pays at the pharmacy. Or you have Medicare supplements, also known as Medigap. And here, these plans fill those gaps, no networks or referrals, accepted everywhere, co-pays and deductibles, yes if you choose that plan in, pretty much no if you choose the other plan. Drugs are not included, you will need a separate drug plan. So those are your two options. Why choose one or the other? I'll give you one reason why one would choose a Medicare supplement and not a Medicare Advantage plan. Some people go to Florida for a few months every winter, go to Arizona for a few months. They're out of the area. So a network-based plan wouldn't work too well. They would want a Medicare supplement plan. Or perhaps they go on Medicare and they have very serious illnesses at the time of going on Medicare. And they know that there's doctors and there's therapies and there's care that they need from day one going on Medicare. Well, Medicare supplement might be the best because there's just about no out-of-pocket cost. The cost will be predictable. So depending on needs, depending on budget, one would choose one or the other. To buy a Medicare Advantage or a supplement, you have to be on Medicare Parts A and B. So typically you enroll in A and B, and once you're all enrolled, then you choose your supplemental plan. You can't do it in reverse. And this is Medicare in a nutshell. Parts A and B from the government, there's your red, white, and blue card. Part C are the HMO plans. Even though private companies sell them, it's still part of Medicare Part C. There's your drug plans, and there's the private supplemental plans on the right. That's Medicare in a nutshell. So I promised you 3 smart Medicare strategies. The first, plan early. If you're turning 65 or older than 65 and getting to retire, give yourself 60 to 90 days to start the process. If you procrastinate and you end up needing to enroll really quickly, the United States government's not going to move faster because you procrastinated. So give yourself 60 to 90 days. Also, I say avoid internet or TV or phone purchases. You're not going to get the whole story. You're going to talk to a telemarketer somewhere in Michigan, and they'll sign you up for something, and if you have a problem, you have to go in customer service. You'll never get the same person. I suggest working with a local Medicare specialist like myself, where I can come to your home, show you different options, and then after the fact, one is always available locally. Okay, so the 2 steps to making Medicare easy. That's our big finale. Step number 1, learn all you can. So, learn about the Medicare basics, Part A and B, and how that fits together, and then the supplements, and then the Medicare Advantage plan. Get all those details of the drug plan down, and the enrollment periods. So figure out how all that works. Now, if you want to know what step number 1 looks like, that's it right there. So, step number 2, skip step number 1. Just call our office, and we'll come out, and I'll show you how everything fits together, give you price quotes from the different companies, and be of assistance in any way we can. I work with folks that are turning 65, older than 65 and retiring, under 65 on disability, and I work with a lot of folks that are just comparison shopping. They have their supplements in place, they just want to see if they can save some money with different companies. I represent several of large companies that sell these plans. Typically, I do in-home appointments, but we have an office in the Pennsburg, Green Lane area, and you're welcome to come to our office. I submit and monitor your application, so it's really a hands-off, carefree process. I send out quarterly newsletters to stay in touch with my clients. You guys have the latest one there. Easy accessibility. I'm very, very accessible. My cell phone number is right on my business card, and all calls and all emails get returned within 24 hours. And lastly, my services are free of charge. So the way the insurance industry works is the insurance carriers pay brokers like myself commissions when we help folks buy policies. And whether you buy through a broker like myself or even directly from the company, it's the same exact price. So you get the skills and expertise of someone who's been doing this for a long time at no extra charge. So that brings us to the end. And I'm available if you have any questions. Yes?
What is the whole thing about applying for Medicare and then defer? So what does he have to apply and then say defer? What is that?
So applying and deferring has to do with Social Security benefits, not Medicare.
Yeah.
There's a strategy where if you apply and defer, you can get some larger benefits for a period of time. But that's not my field of expertise. But applying and deferring has to do with Social Security benefits.
Because I think Medicare, maybe some government one agency that we call, so you have to apply for Medicare 3 months before your birthday.
Yeah.
And even if you're not taking it, if you're still working, you have to say defer. That's not right,
No.
really. So you just don't do anything until you...
Not if you're still working, if you have good employer insurance. I will they'll tell you this, a lot of people that are working and they have employer insurance and they turn 65, they compare what it's costing them to pay for their employer insurance and sometimes the insane large deductibles, and then they compare with Medicare. And Medicare is less expensive with better coverage sometimes. So even though they're working, they say, I don't need insurance anymore, and they go on Medicare.
Especially if you walk your employer.
Yeah, if it makes sense, you have to compare apples to apples.
And then, like, I'm on my husband's plan, but I turned 65 after him, and he's gonna retire. So if he applies, do I have to apply at the same time he does when he's done with the insurance plan?
If you're 65?
Or over 65?
Oh, yeah, sure, same time. If
Okay.
you're gonna be ending coverage at the same time?
Yes.
Then you apply at the same time.
Oh, okay.
Yep. Yes?
Isn't there a situation I was talking to you before about when my wife finally retires, we both go on Medicare? Isn't there something I have to get from my employer to say that we were covered for a certain period of time?
If you're older than 65?
When we both retire, we'll be over 60.
Yeah, there is a form that your employer has, they should have it. If you email me, I can email you a copy of it, just for reference. And it just simply says that Mr. and Mrs. have had health insurance since they've turned 65 with this carrier from this date to this date. And then you take it to Social Security, and then you won't be charged a penalty.
Right, that's all part of the
Yes.
application process.
Yeah,
still on.
and it's a very, very widely used form, and if it's a large company with an HR department, they have
Yeah,
it.
they should have that.
Okay, folks, if you didn't sign in and you want to be put on our newsletter list, feel free to sign in. We have plenty of extra cookies back there. Feel free to take some cookies. And thank you for coming.
Thank you.
Thank
Thank you. It's a good start. Thank you.
Good job.
I didn't see it. I would have been all gone. I didn't see it.